A hospitalist is a specialty whose primary focus is the care of hospitalized patients during their entire stay in a hospital. For insight into this important element of the medical team, we spoke to Dr. Heather Davis Kingston, Medical Director and Lead Hospitalist at Pomona Valley Hospital Medical Center.
Typically, a hospitalist will take care of patients from the emergency room while they're in the hospital and until the time of discharge. So oftentimes, if a doctor who's busy in the office does not feel they have the time to dedicate to taking care of somebody while they're in the hospital, they will request the services of a hospitalist to take care of their patient while that person's in the hospital. Being a hospitalist is the hardest job in the hospital because in addition to having to be an expert in the medical care, you have to be a great communicator. Not only communicating with the primary care physician, who obviously knows the patient best, but communicating with and collaborating with the other specialists who are going to take care of the patient while they're in the hospital, communicating to the family and the patient about the plan of care, and then with case management and discharge planners for post-hospital care. So a large part of what they do involves excellent communication and excellent communication skills. And they require a lot of ongoing continuing medical education, keeping up with the latest research and treatment plans for various conditions. Things are changing constantly, so they have to really keep up. I think the most important part of establishing the rapport with the family is that first communication piece, which is, I am here representing your doctor, the person that you know, that you trust, that you've been trusting your life with for all these years. That person trusts me to take care of you while you're in the hospital and to communicate that back to him. In terms of the benefits of hospitals for the patients, a lot of data has shown that the patient satisfaction actually does increase. Reasons for that are multiple, but generally would include a feeling that they are the first priority for the hospitalist physician. They know the hospitalist is in the hospital and can come and see them multiple times a day, as opposed to if their primary doctor were taking care of them and may be able to only visit once for a few minutes during the day. They know that if there is something that changes abruptly or acutely, somebody is there to come to the bedside, make an assessment, and see what's going on. To be able to communicate with their families. And generally as a result of this, the wait times to get admitted through the emergency department are less because the hospitalist is here and ready to come down and see them right away and admit them. The throughput through the hospital is more efficient and quicker. And the time to discharge certainly is quicker, and that is better for patients, and patients like that. They're getting things done in a more efficient fashion. In the last several years, it's really the fastest growing specialty in internal medicine. We're facing shortages of hospitalists because there are so many programs and hospitals who have seen the benefits of a hospitalist program and are instituting it in their hospitals. In fact, I think now nationwide it is probably the rule rather than the exception, and that was not true 5 years ago.